Hey, everybody, welcome back to The Morning After. We are in studio with an iconic celebrity plastic surgeon, somebody that Kelly knows very well, who is obviously helping to mold some of the beautiful faces, not only in Los Angeles, but well beyond. He's worked with the Kardashians and someone even more famous, Kelly B. Welcome, Dr. Garth Fisher. Thank you so much for being here today with us. We appreciate it.
Thank you. I'm happy to be here. I'm sorry if I sound like RFK Jr. a little bit. I lost my voice, but I'm here.
I told him, I said, everyone loves a raspy voice.
Yeah, why not?
You're good in our studio.
Yeah.
But yes, and for HIPAA purposes, you are welcome to speak on me, just FYI. So yes, Dr. Fisher was my plastic surgeon out here in 2021, I believe was the year. Came to LA, got some plastic surgery. It was pretty great. But, I love, honestly, when I walked into your office, I felt so comfortable, which I think you give off this just aura about you that you're calm-natured. And I really think a lot of surgeons in general, whether it's plastics or whatever, bedside manner sometimes they lack. But this is why that's why I love you, and that's why I wanted to have you on.
Thank you.
Yeah, and not only you're just a incredible plastic surgeon who is well known, and we appreciate you coming. So thank you.
Thank you very much.
But we do start usually our podcast with a segment called It's a Lot. So tell us, what is a lot for you right now?
There's a lot that's a lot. Thinking about it quickly, my surgery schedule's a lot. We're very, very busy, inundated. My house is construction going on everywhere. Too much, a lot. Things breaking down. Yeah. Water pumps, pool pumps.
Never
It's too
ends.
much.
Yeah.
It never ends. I just want to get, the fires were a lot. We're still recovering from that.
Did you have to evacuate?
We evacuated a couple of times, yeah, but we sprayed the house down with fire gel, which was fantastic. I hired a fireman that came to my house. He was fantastic.
Oh, good.
But it takes, you guys get it off the house, which it
Not
doesn't
so
come off as
fantastic.
easy,
Yeah.
Not as easy.
But I still got a house.
Now,
Yeah,
tell me,
good.
when and I know it's based on what surgery you're performing, but how many surgeries could you do in a day?
Well, and that's not the point for me, how many I can do. It's like, I love operating. It's like sculpting or painting to me. It's like
an art.
going out, throwing passes to somebody. I enjoy it. It's not work. But I like to work, between 9 and 5. Sometimes it goes till 8. Sometimes we get out earlier. But I used to work every single day of the week, Monday through Friday, and Saturdays too, operating. But now I'm operating Tuesday, Wednesday, Thursday by choice, and take Fridays off. I travel a lot. And sometimes we have to operate on Friday, Saturdays because we just can't. But there's nowhere to put the patient, and we want to operate on these people. So, but I operate 9 to 5, I'd say.
Are you doing that at the office, like a surgical studio, or do you, there's so many different options now for
Yeah, we have a
surgeries.
surgical center in the office. I think it's the nicest one in Beverly Hills and in our building, and I'm part owner of that. And we operate there. I've probably stepped in a hospital, twice in 30 years.
Yeah.
I think it's safer in the surgery center, to be honest with you.
Yeah.
And easier, I think, for the patient on so many different levels. I mean, just even the check-in, check-out, and just kind of the calm I think it gives the patient knowing that it's all under one roof right there.
Well, yeah, and I don't want to get sued, but I think it's safer than hospitals because you're familiar with your staff. You got the same staff. You got your instruments, which are always better than the ones you get at the hospital. There's no scheduling issues. You boom, boom, boom. You're in and out. You're not waiting sometimes 6 hours for delays and emergencies come in. So, I really like the surgery center setup. It's very consistent and predictable.
I would also think with privacy.
Privacy too. you're
I
right.
would think that's a big thing, especially with the high-profile clients you work
Yeah.
on. Privacy. I mean, I know I felt it walking in. I didn't want to be seen by anyone. So it was nice to know that was kind of your own thing. And also the safety is huge. Now, besides being a doctor, you're also a dad, which we have a lot of moms listening to this podcast.
Right.
2 daughters, correct?
2 daughters.
Can you give their names and ages if you don't mind?
Yeah, Nariah Fisher, she's 25. She's the oldest daughter, and Sierra Fisher's 23, and she's the youngest daughter. And I paused because this time of year they were born, so it might be 20. Yes, 25, 23, not 24, 22.
Okay.
So,
And-
yeah.
And how do they feel about having a dad that's a famous plastic surgeon?
I think they're oblivious, really. They don't know really what I do. They're scared of blood. They come in, they get their, well, I shouldn't say what they do, but
Yeah.
they've never had surgery before.
Yeah.
And but they come in and they'll get a facial and they enjoy that.
Yeah.
But I don't think it's really an understanding.
I really think it's interesting. Like if I'm like putting myself in their shoes and I get to the age that I'm at and maybe I want my boobs done. Am I going to my father? Like, I think that's a very interesting dynamic because you want the best of the best.
Yeah.
But it's also like, but it's my dad.
Oh, they're coming to me. They would never go
Yeah,
anywhere
you're
else, and
like-
I wouldn't let them go anywhere else.
Okay, there you
Yeah.
go. I like that. Like it is what it is. It's a job,
Yeah.
and But I found that very interesting, and I agree with you. Like if you know you're the best, why would you allow them to go somewhere else to get it
I
done?
wouldn't trust anybody else.
Yeah,
Yeah.
I love that.
Do you find now, because of the advent of social media and just, I mean, Los Angeles is always very aesthetic to begin with, right? But so much has changed within the last decade. Are you seeing younger and younger people coming in for enhancements or changes, or no?
Yes, you see younger and younger, but I'm pretty firm on what I
Age.
will and won't do. I think the social media has been great if you're mature and can handle it, but I think it's ruined a lot of things, and I'm very careful with that as far as plastic surgery. They're looking at the lens through all these filters, and they think they can accomplish that, and
Right.
it's just not realistic.
Yeah.
So have people come in and said, "I want to look like this"?
All the time,
Yeah.
all the time, and you have to say that's not going to happen, and just stand your ground. I mean, because for me, I really want my patients to be happy at the end of the day, and that's going to require two things. I'm going to be honest, and I'm going to do a good job. And if they think this is going to happen, and it's not, then somebody's going to be in it, upset at the end of the day. I learned a long time ago, if my patient's not happy, they're going to make me not happy
Yeah.
they are.
too. So I've got such a good life. I don't want to have that happen.
Yeah.
Really. So
Have you had any patients who literally come in and they ask for something, they come back later and say, "Well, you didn't do what I asked," and they want you to do it for free again? Or something different. Like, have you ever had? I imagine, and I worked for a plastic surgeon in Detroit. We did have some wild patients who, and it was more. It wasn't. He did surgeries, but this was also an aesthetic situation with Botox and filler and all those things. And people would come in and they would be like, and we know these patients very well, and they come in, and they're like, "Do you see this line?" And you're like, "No."
Yeah.
Yes. What am I supposed to say? I don't know. But I imagine there are instances where people think they're going to turn out a certain way, and it doesn't get there. Do you have people coming in and trying to demand that you do it again?
Yes, I do. And I could use an analogy if this is fair, but sometimes Matt throws a great pass.
Yeah.
The guy drops it.
Yeah.
Sometimes he throws a bad pass. Wish you could do it over. But when
Yeah.
you get a little bit older, you things move slower. You see all the defenses. You understand you read the defense. You know everything about everything. So I kind of feel like I'm the elder statesman in that way, that I understand. I try to be very honest with these people, and if there's something that I did I can improve, I usually say, "Come back in here, let me fix that for you." Then there's the patients on the other end of the spectrum. Everything's perfect, and they're complaining of a facelift patient. How come my eyebrow? I have an eyelash that's white. I never had a white eyelash. How did you do what? It goes into this whole thing, and you just have to. You really have to understand what you're dealing with before you take them in the operating room. And I think that's our strongest word that we have in our vocabulary is no. And I'm not shy to use that anymore.
I love that.
Yeah.
'Cause
And a
honestly-
realistic expectation, too.
Yeah.
Well, I don't sell anybody anything.
Yeah.
I really don't.
Yeah.
And that's probably why you are, or where you are today. I mean, because I do think there are surgeons out there that will do anything and everything to make the extra money. And that's how I kind of wanted to ask you that too. Say someone came in and they wanted, something outrageous and you also have a reputation to
Right.
uphold. Are you considering, or are you just absolutely downright saying no?
I say no I probably turn down 20%, 15% of the people that come in our office. And, there's different reasons. My wife hates me. My husband hates me. I'm ugly. You're not. These different reasons where they're insecure. They shouldn't be. They're panicking. But they'll come in. The toughest ones are the ones that come in that have had a lot of surgery, and you can improve them. You know that you can make them better. But then at the end, you don't want your name on that because you can't make it a 9. You can make it a 5.
Right.
And so that's the toughest one because I want to, and sometimes I do that. But there's a lot of them that, they just don't need surgery. They need to just go home and start removing mirrors from their house until the symptoms go away because they're looking at things that just shouldn't be a problem.
Yeah.
So, but I see a lot of those people too. But the clear-cut people that you can help, that's what makes my job so wonderful is every day I'm doing something I enjoy, and at the end of the day, I got somebody on the other side of the table who's really happy and changed their life, made them feel good about themselves. And it's a real positive instead of being like an attorney and somebody's always going to lose. It's like,
Right.
oh,
Yeah.
I like my job. It's great.
I mean, I felt great after mine. I felt very confident.
Yeah, it's good.
And for, like I said, a lot of moms listen to this, and for what I got done, I would consider that like a little bit of a mommy makeover. I had my boobs redone, and you also did the tummy tuck, and you put back together my abs. And I will say, like, and this, I was discussing this with some of the ladies before you walked in. Unless you live, well, I'm not going to say that, but a lot of people who live in California know what a tummy tuck is. But in my mind, when I was told a tummy tuck, I was like, that's lipo, right? Lipo, not libo. I get that wrong a lot.
You were
Lipo,
thinking fat
liposuction.
removal.
I was thinking fat removal and then skin. And I remember being like,
I'm not fat.
You don't have any fat on your body.
I remember being like, oh man, okay, well, but then either you or your nurse were like, no, this is just skin and whatnot. But with moms who have obviously given birth and who have the extra stuff going on, how long do you, and they know that they're done having kids, because I know that's big. Like, you don't want to go in and get a tummy tuck and get rid of the skin and then get pregnant again, because that's
correct.
Kind of a waste, or it is a waste. But like, how long do you think you should wait before even considering going in for a quote unquote mommy makeover?
So I think it's best to get back to your ideal weight or fighting weight, or as close as you can to doing that without, having to take Ozempic or, be on Jenny Craig diets or some of these fad diets. It takes 6-9 months, sometimes longer, sometimes never, but I think you got as close as you can, because if you come in overweight and you do this procedure where you're lifting your breast, doing a tummy tuck, removing skin, and then you eventually lose the weight, things are going to get a little loose again. So it's best to wait, and being patient is one of the hardest virtues for anybody, but it's really the most important one. And so I think it's best to try to get back to ideal weight. And for the breast, if you're putting implants in, you don't have any milk in the glands or ducts, because that increases the risk of capsular contracture, getting hard breasts, which is really the most common problem.
Yeah.
So I would say that's the most important, is trying to get as close back to your ideal weight. And it's unfortunate. I shouldn't say unfortunate, but women, have babies, and I've been around women all my life. I grew up in a house full of women, worked in a women's clothing store. I had women. I'm never around men, so I understand a woman completely, and they're the superior species. I can tell you 100% what they're able to do, and so I've come to appreciate that. But they give so much for kids, and at the end of growing their kids up, they don't have time for them, and so a lot of times you see them coming in 18 years. Their youngest kid is now 18 years old, and it's like, God, I wish they could just take 4 or 5, 6 weeks out of their life to just get this done during the period of time where they, but it's hard. It's a big job.
Yeah.
It's a big job, as you know.
And I do agree. Like, you want to kind of do it when you still have that urge to feel sexy and to feel, and I'm not saying 18 years down the road, I might have a resurgence of that, but I also just think you're older in age and it gets tougher. But I will say you made a good point in the patience aspect. These women, as I felt, you have a kid or you've had multiple children, and you haven't really felt like yourself since before you had kids. True. And so there is that, just like, I'm done. Yes, let me go feel like myself before.
I love that.
And I love that, but you're right. You do have to have patience in the fact that you have to get back to a certain form of yourself that is maintainable. And that's why I love that you said no Ozempic, no Jenny Craig's diets. Like, do it naturally in the way so that you are not losing all this weight, getting this, and then gaining again.
You have to sustain it.
Yeah. I mean, there's obviously moms are all over this right now, and also talking about implants. There is, I remember, God, when I first got my implants, they were saline because silicone was frowned upon. This was, I don't even know the year of this. And then now they were like, do you have saline or silicone? I was like, I'm pretty sure I have silicone. But how often would you say that you need to get breast implants like replaced or redone?
So I get asked this every day, and the answer is nobody can tell you how long they last. I've seen them last 5 years. I've seen in 2007, we took out a pair of implants from somebody I had them put in 1965.
Oh,
it was
my
literally
gosh.
some of the earliest implants that ever were made, which were terrible implants, terrible
What did they
technology.
look like? I'm so intrigued.
Well, so 42 years later, we're taking them out. We're excited because it's like digging for a dinosaur
Yeah.
bone.
It's like a time capsule.
So we take them out, and to my surprise, these things were fine. They're okay.
Wow.
And I'm thinking if that can last 42 years, and in the last I'd say 6 weeks, we've taken out 3 different patients who had 35-year-old implants that were fine too.
Wow.
So I don't know, but you can't tell. So there's a 10-year rule thing that they give you when you buy the implants, and I think it's a CYA for the implant manufacturer. I can't go across that, against that, but I think that for me, you take them out if you're having a problem. If you had a seatbelt injury in a car, you fell on an ice skating rink or something's weird, get them checked out. But these things, I've seen them last 20, 30 years all the time.
Wow.
And now is silicone kind of what's the preferred?
Most people choose silicone. They both look the same pretty much. They're both safe in my opinion. They just feel a little bit different. For a thin-skinned patient, silicone's going to be the ideal choice. For a thick-skinned patient, doesn't really matter. But I think that most people prefer silicone implants, and that's what I would recommend.
So then when it went through that whole controversy in the 90s, tied to Dow and the implants that were being made there, is it just a completely different manufacturer or a different way it's put together? Or why is it now not a problem when before?
Well, there's a probably longer story than your podcast, but I'll just tell you that Dow Corning, it wasn't that they made anything wrong. It's just they didn't do any tests to find out if it was safe. And so, here 1 in 10 women get breast cancer. And, after they put in these implants, there's somebody in Maryland, somebody in Texas, somebody in Idaho, they got cancer after their implants. Must be the implants. So they sued Dow Corning. And Dow Corning, did you guys do any tests? No, we didn't do any tests. Well, so they got on the line for the lawsuit. They went bankrupt. But, silicone was restricted for use. And I was part of that study with the FDA. Is between 1997 and 2007, it was not for use because they're trying to clean up all this and look at the numbers. And they found that silicone implants don't cause the problems that people thought. When you look at the general population, the same percentage of people getting these issues, whether they have implants or not. Yeah. So it's back on the market. It's all fine. You just have to worry about capsular contracture. And then this whole thing came out with lymphoma, 1 in 15,000 and 1 in 35,000 risk of lymphoma with textured implants mainly. So those were taken off the market.
Yeah.
Textured implants.
Yeah, which kind of is a good thing to talk about is, I think, people are always wanting to know what's new in plastic surgery. And that's one of the most often questions my entire life that people come to ask me, journalists, when they're on a TV show, radio, podcast. Yeah. What's new? Well, that's the wrong question to ask because I think probably in the industry is pushed along, make something new, make something new, make something new. The question to ask is what works the best? What's time tested? What do you not have to worry about? Because I was thinking several days ago, in my career, 30 years, I've been through 10 different new implant technologies.
Oh my God.
And 10 of them have come and go for reasons of cancer, possibly lymphoma, whatever. And I've been using the same smooth silicone implants. There's great manufacturers that are new, that are not new. They're time tested, been there a long time. And these implants have never had a problem other than the general problems of, maybe not lasting forever and capsular contracture, but a lot of new things. They come in and 3 years later, they determine they're not good. So new is not always good. It's good for the moment, but it's not good. I mean, there's such a improvement in marketing more than innovation, and that's what you're seeing. I've seen them take the same laser. Oh, let's pull this out of the closet, give it a different name, and advertise it. Then people want to go see that. It's new.
Yeah.
So it's just this is not the market that you think it is.
Yeah. So all these trends, right? We're getting all these trends through social media and, like the new or even the lasers, the non-surgical treatments. So it sounds like you don't buy into that. It is more like stick with what you know, stick with what you know is good. What do you think, what are the good ones that you're like, I know for a fact, and maybe it's just silicone implants or ways you do facelift, or is there anything that you were like, I will use this until I'm done?
So I've gotten to it's like study. Okay, I've gotten to, if you study, you know how you got to study, make a test, you're going to make 100 or 99. Why am I going to learn a new trend to learn how to study and make a test grade? I know it. My results are predictable, reproducible. Things have slowed down for me. I understand everything. I don't need anything that new. I'm all for new technology, but I'm not going to jump on a bandwagon until I know it's been proven and it's not going to be pulled off the market because I don't want my patients to be, guinea pigs for all this stuff. If I see something definitely improve what I'm doing, I will use it. But Until then, I'm modifying my technique out of 24,000 breast cases and a lot of facelifts. I've modified my technique to where I know it's reproducible, predictable, and I know it's going to happen. So there's a lot of, even out there, I've got my own name for a facelift. There's like 7 or 8 different names for facelifts. That could be the same name, same facelift, but it's a different name. And so, I'm throwing a long bomb. You got 4 different quarterbacks, throw it differently.
Yeah.
It's just everybody does it differently.
Yeah.
Wait, you have a Dr. Fisher facelift?
Well, when I did Chris's, it was, we called it the pinnacle facelift, and then people started calling theirs facelift different facelifts and advertising them differently.
She looks fantastic.
Yeah.
What's the pinnacle essentially? Like what is it? Is it? I mean, I hear terms like deep plane facelift. I hear like what's the strategy?
Well, it's a deep plane facelift. There's basically 3 types of facelifts. One's a skin facelift, which you want to avoid at all costs. The other one involves the deep plane, which can be utilized, maneuvered around many different ways. And then there's subperiosteal. People don't really use that so much. But
so deep plane is the kind of preferred.
It's the preferred. You want to use this. You want to use the deep plane, or what's called a SMAS. You want to use that to your advantage to elevate the tissues. It's a little bit more technically challenging, but that weeds out the people like dermatologists that shouldn't be doing these things, and dentists. And it helps keep the face up, longer. I think it's a more natural lift. And then there's 2 most important things about a facelift. Is number 1 is the pull, and the second is the closure, and they're equally important. I would suggest that the closure is more important more difficult to do than the pull. But you want to pull the right direction, the right tension. But then you don't want to see scars. You don't want to lose a hair. You don't want your ear pulled down. You don't want people looking at you across the dinner table saying, "What's wrong there?"
Yeah.
So those
and there are those that they stand out
there. They stand out there.
Yeah.
They stand out there, and it takes a lot of time. You can't do a real good facelift in 3 hours. You just can't. That takes a long time to stitch it up and make it look perfect.
Yeah.
Okay, this is blowing my mind already. Now, if you had you have a favorite surgery, do you have a favorite surgery type of surgery? Do you prefer to do facelifts over breast augmentations or tummies, or like what is your like? You're like I'm excited I get to do this surgery today.
I love faces and breasts the most.
Okay.
But if Tom Ford wants his ears pinned back, I'm loving that too. So it depends on the personality. It depends on, not that he needs anything. Anyway.
Yeah, did he get his ears pinned back?
No. But I love faces. I love breasts. I love operating. If I don't like to do it, I won't do it.
Yeah.
I just don't want to do it.
I would think like the face is definitely like it's all art, but the face, there's so many different, I don't know, like it's things going on the face that it would be
The
such
muscles,
an art to kind of figure out.
Yeah, well, it's not really, not to me. I mean, it's so somebody who knows art could come in and say, well, that's that.
Yeah.
I see what that artist is. It's a reproduction, or this is original 1838, whatever.
Yeah.
I'm at that point where it's not. I kind of know what's going on. It's just the technical part of enjoying doing it, But I spot it immediately.
Can you spot work done across the room?
Good work, no, but bad work, yes.
Who
Good work.
Who do you look at? Like I have a celebrity that I look at and I say, "Wow, that's some good work." Like I look at Jane Fonda and I say, "You're in your late 80s.
She looks great.
And you look incredible." I mean, yes, Kris Kardashian looks
She
incredible
looks incredible.
too. But are there people that you've looked at who weren't your patients and you think, "Damn, that was good."
Yeah, I'd say Jane Fonda's a great one. I
Yeah.
think Cher's a great one.
Cher is a great one.
Yeah.
And what about some of these younger celebrities who, like, we call it a glow up, but like Lindsay Lohan out of nowhere this year popped up on the surface again. Now Anne Hathaway just a few weeks ago was photographed, and everybody's like, but you would traditionally think these girls are too young, these women, for a traditional facelift. I mean, they're in their 30s.
Well, a lot of times it's not a facelift either. And it's maybe a little bit of filler, which, by the way, I think is the worst used. People are overfilled so much.
Filler's
There's too many
no good.
people with big lips and big this, big
Yeah.
this.
Agreed.
That's the worst. It's like having a weapon in your hand. So I think a lot of people are overfilled. But the right amount of filler, Botox, and good skin care, and they may look like they've had surgery and a makeup application, put a filter on that, and you're good to go.
Yeah.
I mean, Lindsay Lohan,
Glow up.
we had this debate though.
Yeah.
And I was like, I think she just looks good. Like I don't see surgery there, but I mean, again, good plastic surgeon, you'll never know.
Yeah.
It's incredible, though,
what
the
they want you to do is
transformation.
to debate.
Yeah.
Like, wait, do we think she had something? And, or do you know? So the answer is, do you ever get nervous when you
Never.
have these high profile
Never,
clients?
never.
Wow.
I haven't been nervous since I was doing trauma surgery. And this was back when I was doing my residency, and you have somebody coming into your table in the emergency room, in the operating room, and you got 1 minute to save their life. And you realize if you're panicking, it's over. You just can't do that. So I was sitting on the edge of a silver table when I was 7th year or 5th year resident, and it was my time because you work your way up. First you're the little guy in the room helping out. Second little guy in the room. 3rd year. Finally, at the 5th year, you're lead quarterback. You're head of the whole thing. And I remember the guy came into the room, and I'd done, I don't know, thousands of trauma runs. I'd just seen it all, but then it was my responsibility. So the guy came in, blood pressure 50/20, multiple, car accident injuries. And I said, oh, shit, I'm going to kill him. I'm going to kill him. I'm going to kill him. And I said, you can't do this. You got to look at this another way. And I just twisted my brain. I said, no. You can't look at this because you will kill him. You got to assume he's dead, and you're going to save him. So you're all good. It's all good. He's dead already. I'm going to save him. And so it took the pressure off me. I never got nervous again after that under any circumstance. It really helped me a lot.
Like when you said, and obviously it's very well known of who you've worked on, but when you say these names, like I get nervous for you because I just feel like, that's a Super Bowl in a way. Like you can win or lose that in a way. Obviously you've won every time.
But it's the drive. It's the drive to win. It's the drive. I want to make this work. I'm going to do this so good. Give me a chance. That's what it is, really.
Yeah.
Now, what are some signs? Because again, I know our audience is probably wondering, what are some signs that you would say, okay, maybe it is time to go in and talk to a plastic surgeon about a possible facelift? Like what are like some, I don't know, early signs?
Early signs. So usually people come in, I tell them you don't need it, but I'll tell you when you'll benefit from it, because need has a lot of reasons behind need. Like I need this because I need a boyfriend. You look great. I can tell you when you're going to benefit from it, and you benefit from that. Everybody has facial sagging, but just because you can pull your face back doesn't mean you need a facelift. You go to a 3-year-old, you can pull their face back. That doesn't mean you need a facelift. But usually the cheek descends down. And
why are you staring at me?
He's been wanting one, so it's okay.
No, don't worry. We're going to get into my consultation here in a minute.
Well, Kelly doesn't need anything.
Kelly's also 13 years old.
No.
So.
No, look at you. You have a very handsome look. Okay, the cheek comes down and in, so you start seeing more volume down here, nasolabial fold. You get this little pouch here. It may be a sign like the jawline. Jawline's not really distinct, or you start getting these muscle bands right here underneath your neck, what we used to call the turkey gobblers. And they start with little miniature, and then they come. I need a facelift.
I got a little turkey. Have you had one before?
No, I need one.
You do not.
You look great. Y'all, it's time to start giving our kids what they need. They have gaps in their diets just like we do. And we all take multivitamins and supplements to try to counteract those gaps in our diets. We should be doing the same for our children, but with not just any kids vitamin, because if you look at it, a bunch of these kids vitamins that are out there right now are just filled with gunk. But that's not Haya. Haya is honestly, it tastes great. My kids love it. But more importantly, it's actually giving them the stuff that is good for them and what they need. It's a blend of 12 organic fruits and veggies, supercharged with 15 essential vitamins and minerals. It's non-GMO, vegan, dairy-free, allergy-free, gelatin-free, nut-free, and everything else you can imagine. It is designed for kids of all ages, and the best thing is it's sent straight to your doorstep. So we've worked out a special deal with Haya for their best-selling children's vitamin. Receive 50% off your first order. To claim this deal, you must go to hiyahealth.com/morning. This deal is not available on the regular website. Go to hiyahealth.com/morning and get your kids the full body nourishment they need to grow into healthy adults. If somebody wants something, they can be like, oh, I see it. What do you think, like, if the average age of a facelift, it makes sense?
Well, the youngest I ever did was on Extreme Makeover. It was this 35-year-old woman that was just torn up. She was out in the sun in Florida and just working around her boat every day and just was really in bad shape. She looks beautiful now. But then I've operated on an 80-year-old. So it just depends, because some people, there's a different view. When you start seeing the aging, say around 40-something, and you start seeing it, but you don't want to live through it. You don't want to feel the baby, so you want that shot in your back. You want the epidural, right? So before you get really aged, you want to have the facelift to preempt that and scoot through that time period. Then there's other people that their friends are dragging them in because they waited too late and they want to see a dramatic result. So there's different viewpoints of a patient of when they want to do it. And, if there was a sales line, they come in, they say, gosh, when should I do it? I said, well, just tell me when you want to look the best for 15 years.
That's good.
Start when. You just give me the date. So, but I think when you just, start feeling a little tired and looking a little tired, I should say, and you start seeing those changes that are harder to clear up. Usually, you go through that transition phase of Botox and fillers and things like that. And I tell people, look, it's like a river bank. Here's one river bank, you don't need surgery. The other river bank, you do. And then in the middle of the water is when you're doing the Botox and the transition stuff and fillers and maybe skincare and doing a little bit of other things, deceptive, contouring and everything else with your makeup. But at some point in the mid-river, you decide, I'm going to just go do this so I can get over, these little issues that I have. And and then I put, it's going back to one of your earlier questions, I love using this blackjack scale because I don't know how many people here play blackjack, but a lot of people play blackjack. So, when you get a 21, you win. Yeah. So you get a 10 and a king and an ace, you win or whatever.
Yeah.
So I put people on a blackjack scale and I say, look, you're a 19. You may not get a 2. You may get a 3. There's not the time to draw the card yet. Why don't you wait? And so the closer you get to that number, 21, it's better to wait. Well, if you're 15, 14, time take a card, come on in, I'll help you. Try to get you a blackjack. So I use that scale and I actually write down on my piece of paper what I think these people are because it helps me. Because I know how my judgment is.
Yeah.
On that, so.
So when they walk in and they're not ready yet, you write down like what's a common number for when they're not ready?
19, 20.
19, 20. And then so in their file, you have 1920. They come back in and they're like a 14. You're like, it's time.
It's time.
Yeah.
And the sad thing is somebody, you give them a 20, they think you're wrong. They'll find somebody that tells them this is an emergency. You got to have this done. Take their money, get it done. Then they come back. Oh, what have these scars? It's just all these things that they don't like. And
I love and I know it frustrates people, but the honesty of a plastic surgeon, I feel like one, it can be rare because like you said, people are just wanting money, but two, that's what you want. Why would you go to somebody who's just going to tell you what you want to hear and take your money? I mean, it just baffles me.
They've convinced themselves.
I had a patient flew in from Montana or some state over there. She fully paid for a facelift, which was quite a bit. And I'd looked at her pictures and I thought she needed one. And so she came in and when she got in my office, I thought, you don't need one of these. She said, you saw my pictures. She says, I was wrong. Your pictures were your pictures, but you don't need this. Go home. She got her money back and left. I took a day off, but
well, good.
Yeah.
I mean, that's what I was saying.
She looked great.
And I do think women get this, and men, but they get in their mind like, oh yeah, like I'm gonna get this done. I'm gonna look so much better. When a plastic surgeon's like, you don't need it. You're like, nah. What? It's almost like you develop this picture of yourself that you don't think you look good, and this is gonna make you look so much better. And then when someone tells you look good, you're like, but I don't. I don't know. You get that. I just feel like you get stubborn.
Yeah. Yeah.
And it's like, do you think plastic surgery? Because there's all these things like that. Plastic surgery is addicting. Like, do you have clients that you've had to say no to because they've had this become addicted or have developed an addiction to it?
Well, there's addiction and there's kind of addiction that's not an addiction. So the addiction, those people have altered views of, of what they really look like. They just don't know who they are. And whether that's generated from bad relationships, men, catty women, who knows. But, certainly they're not the ideal candidate to operate on. But then there's people like Michael Jackson. Now, he's had 8 nose surgeries. I don't blame him. I mean, I'd want that fixed too. The problem was the surgeon that said yes to do it because they knew they couldn't fix it, but they kept taking his money and doing it. But I don't know that, he knew what he wanted to look like. He had definitely had his goals, but I don't think he was addicted to nasal surgery. He had a reasonable reason to do it. But, that I don't think is addiction. But on the other hand, then you get a patient that has a great result. Like, shit, what else can I do?
Yeah.
What's next?
Yeah.
They start looking at things to do, and they come in. If I can help them, I help them. I can't. You're 19, 20, goodbye.
Yeah.
So,
And oh my gosh, I really think in like the last decade, like you said, all these plastic surgeons are probably making a good amount of money solely because they're taking everyone on who's coming in and saying, I want to look like this with all these filters and everything else.
Wrong approach.
Yeah. And I love that you term people like, I can't make you look like that. Because I'm sure there are plenty of surgeons that are going, let's hang that up right there. We
Quick
can
money grab.
Yeah.
Yeah.
So now I do think I still find it interesting, like with daughters. Are there any plastic surgeries that you would not feel comfortable letting them do because of the danger of them? Is there any surgeries like that within plastic surgery?
Or they just don't, they're not worth it because you're not going to get the intended result.
Well, a lot of them, I think, first of all, you have to know how mature is this child and what is the real problem. I'm never going to do liposuction on somebody who's young. And, I'm not going to do a lip lift or upper lip lift or something like that. But, if a child's 13 years old, 14 years old with a nose that's so, crooked or big that they're going to be just, it's going to form a scar because they're going to be just ridiculed their entire, school, during school. I'll fix that for them.
Yeah.
Okay, I think that's really helpful. I'm not going to do breast augmentation. I've had some patients where, somebody's got a really bad deformity and they're not going to be able to get in the gym, in the locker room, and those people I will do. And, so it's more judgment for me. And I think with my daughters, life has kind of changed. When you have a daughter, I always tell people, you won't know what love is until you have kids. Mm-hmm. Don't think you know what love is until you have kids, because that's what love really is. And so what I think has changed for me after having kids is, when a patient brings in their daughter, I'm like, I got it. I know how you're feeling on that chair over there. I'm going to take care of them. I got daughters too. Don't worry. But, that's what's that's what's been a little bit different with knowing I have kids and seeing somebody bring in their kid, their child.
Yeah. Do you ever have, like, when you say bring in their kids, obviously we are thinking when they have something that they're going to get made fun of in school and things like that. Have you ever had a client bring in a kid because they want something fixed that you might not think is worth it? Like, you're like, they're fine?
Oh yeah. If in that scenario, I would just be honest and say, I'm not doing this. I'm not going to do that. Look, I've had people come in my office wanting to have a tongue split in two to look like a snake. I've had people come in. There's a girl that coming in that wanted breast implants on her back. She was a stripper dancer, and I said no. And you know what? Years later, she got him.
Yeah.
She was dancing. I mean, I've had a lot of people ask different things. People change my identity. I don't want anybody to know who I am. I don't want to be associated with that. It's hard to back out because I don't know. I don't want to get killed. But there's a lot of stuff I've seen. But
was she trying to just get tips on both sides of the bar?
I am stuck on the kids on the back.
She's a novelty. It's a novelty.
Yeah.
Is she so, like, I mean, she's got to be
I've heard of this,
You've heard of this girl?
I heard, yeah.
Whoa.
Yeah.
I'm going to have to look it up after this.
How young is, so we would have this debate for years because I always thought, this is when she was in her 20s and she was getting Botox, Kelly.
25.
Preventative Botox. Young people use this term now all the time. They're saying, well, if I never get a wrinkle, I'll never have a wrinkle. Is this true, or is this just buying into,
Well, there's a time to do it. There's some people that make facial expressions. Like the worst one is just, I can't do this kind of Botox, but you're squinting and you get those 211s. You just do this all through school. And, a girl, so sometimes you do a little Botox to keep that from getting worse. Because that's one of the first things you look at to determine how old somebody is. It's just a cue. But I think that's 18 years old, 19 years old, I don't have a problem doing that. You got to use your judgment and be very conservative about this. You don't want to prevent something, but if you see it's going to happen because it's one of the outliers, it's something that's unusually frequent that they're doing, and okay, step in. But it's not for everybody. You have to choose this case by case basis.
What do you believe are the things that can actually help with the sagging? Like, as you age, as you said, like the sagging of the skin, is there anything that can help prevent or just like prolong the non-sagging? That's non-surgical.
Yes, don't get out in the sun too much. Don't smoke. Lay on your back when you sleep.
Unless you have implants on your back.
Hard.
Why does she sleep?
How does she sleep? That's a good question.
I can't either.
I'm like a stomach side lying situation.
You're doing pretty good still.
Okay, all right.
Get some satin silk pillowcases.
People love the Blissy pillows.
You still want to rub your face. And,
Do you believe in the lasers and all that?
So I do believe in lasers. I just think they're temporary. And I think when somebody tells you we're going to sell you a package, I think it's just kind of a lot of these things are scams to me. Because if you're looking for something temporary, everything's under the preface that, I'm going to make more collagen. You can slap your face and make more collagen. You can get out. It's like
can slap me.
But what happens? Injury causes injury causes repair, which causes So these lasers, they improve things. but a lot of this is swelling. Then you get over the swelling, and then 6 months later, you look in the mirror and says, I don't really see much of a difference. You know, it's not something that's permanent unless you go down really deep. Like CO2 laser will make a really definite change, but that's a big deal to do your skin. You don't do that too often, but the deeper you go down, the more risky it is because you can start changing pigments in your skin, get too light, too dark.
Yeah, that makes me nervous. I feel like there's so many side effects that lasers. Yeah. I mean, I got burned with an IPL, which is supposed to be like not that aggressive. I had burns all over my face. And I'll never forget it because we had a ski trip and I had to wear Aquaphor with pads all over my face.
Right.
I went out like that. We
Shouldn't be in the sun though.
And I had a helmet. I tried to I know. And I did. I had all the patches on, hoping that the sun wouldn't touch it.
Yeah.
But no, we would like go to the bars, and this was years ago before kids, with our friends, and I literally had Aquaphor with patches all over my face.
Maybe just not go to the bar that night.
I don't miss out on a good time. I don't miss out. Listen, people can judge. I don't really care. But no, because I wanted I'm freckly and I have sunspots and I'm doing my best. I wear this massive hat to tennis where I can't even see the ball, but here we are. My skin's more important. But I will say like the CO2 laser, stuff like that, which I am intrigued by, but I can't deal with the pain. Like I can't my pain tolerance I think is very low.
Well, you should be put to sleep and do it.
And I'm into that.
Be put to sleep to the CO2 laser. It's not good for olive-colored skin. It's not great around the mouth always because these are difficult wrinkles to get rid of. But it's very demonstrative. The changes that you see, got to pick the right patient, and afterwards got to stay out of the sun quite a while. You're going to look red. The deeper you go down, the more effect it's going to have. But the longer the longer recovery period.
Do you think I'm a candidate for a CO2 laser? Like I'm kind of feeling this right now.
I'm looking at your skin right now. It looks beautiful.
Well, thank you.
I think your skin looks really great.
Yeah, your skin looks great.
What is your regimen?
It's funny you asked this because people have been asking, and I'm honestly a little ashamed to say it, but I run very dry. So I have an oil and a moisturizer, and that's kind of it. I do a retinol sometimes.
Retinols are one of the best products because you definitely can see some histologically.
Yeah.
Some pathological. You can see the results that the retinol, can build it can really make the skin a little bit thicker.
That's good
better
to
for
know.
round. But you animate a lot, so you can see wrinkles are because you're smiling. You're smiling. You're yelling at the game. But the only wrinkles you have is around here, and it's because you're smiling. So hang around boring people. That'll probably get better too.
When you're buying products like at the drugstore, are there some key ingredients you should be looking for if you're looking to make yourself look more youthful?
I think moisturizers are really important. You have to just find one that you like, and there's so many out there that are good. Retinol products are great. Start off with something that doesn't make your skin too dry, and find that, put that around your eyes, stay out of the sun. I think that's really good. I use this, not that I'm a model of any kind of youthful look.
No, please tell us.
I found these little pads called OcuSoft, OCCUSOFT, OcuSoft. And they clean around your eyes and your skin. It's like the cheapest thing. And you do that twice a week. And I think that's as good as almost anything.
So it's a cleanser?
With a little moisturizer. It's a cleanser. It's a little bit of a dermabrasion, debridement, because you're using it around your eyes. And it's really spectacular. It's safe around the eyes to use. I probably could use it, take off your makeup, and then put a good moisturizer on. And I think you're good to go.
You hear so much about hyaluronic acid.
Yeah, that's in your body. Those are in fillers, and that's good too because we do lose volume. I just would suggest don't put as much in. And when people come to me, they say I've got a nurse that does Botox and fillers for me. She's fantastic. Been there 27 years. She's conservative and just great. But people come in and say Botox doesn't work for me or fillers don't work for me. I said, no, you can't look at it like that. It's like if you gave the best paint, best paintbrushes, best canvas to 10 doctors, you said, draw a picture of a face. You would have 10 different pictures. 2 would be like, wow, that's fantastic. 2 would be looking like cartoons. And the other ones are like, I don't know. So there's ability and a talent in injecting. And just because it doesn't work where you go, doesn't mean it doesn't work for you. It means you wouldn't.
To the wrong place.
Arnold Schwarzenegger would need a lot more Botox in his bicep than I would.
Yeah.
It's just muscles are different sizes, and you may need more. And there's some people out there that dilute this stuff, like the old orange juice, where you had the frozen orange juice, 3 cans of water, it gives you a picture. They put in 5 cans of water. It's just there's a lot of things out there that people just don't understand.
Gosh.
Yeah.
Do you? I mean, that makes me sad because I'm like, where have I gone that it's been diluted? I'll tell you where I.
Oh, great.
Well, we had a story. What it was like 6 months ago, 6 or 7 months ago, before kickoff the season. I went. I got lazy and I didn't research, and I went to someone very close to me in Calabasas in a strip mall. Like, who does that? And I'm a trustful person until you give me a reason not to trust you.
Yeah.
Well, it turns out you can't do that when it comes to this stuff unless you just can't do it. She kept selling me. She's like, yeah. And I hadn't really gotten a ton of filler in my life. And she, I think, put like 6 vials of filler in my face. I looked. I went to Detroit because we had a show.
Yeah.
Oh no. Oh no.
She looked very different.
I looked like a different human being.
Yeah.
And turns out it costs more to get it taken out.
Yeah.
I mean, real quick, because you asked me this, which I think was an interesting question. When you do facelifts, is it harder when there's a ton of filler in there? Like, or that person?
I've just heard people say, like, I've heard some surgeons say that they've gone to do a facelift on people who've had a lot of filler, and it makes it more difficult.
Yeah, I ask them to take it out as much as they can.
Okay, so
That's
before
what
they
I
come
ask
in.
them to do.
Okay,
Yeah.
and that way you know what you're actually looking at, right? Not
If there's not so much, it's one thing. But if there's a lot, I tell them to take it out.
Yeah. But I will say, like, researching the people you're going to, like, your nurse has been there for 27 years, been doing it. And I also think when you're doing it the first time, they don't know, if you're going to someone new, they don't know how strong your muscles are. So you might have to go back and be like, all right, maybe it's too much, maybe it's too little. But it's like a process, and you have to know who you're going to. Because I really
you do.
messed that up, like, really bad.
Sorry for my voice. This must sound so terrible.
No, you're fine.
The voice is great.
Have you seen within the last decade or so many more male patients, or has it? I mean, it's tough for me to gauge this. You're in Los Angeles. Everything is aesthetic out here. But like, is the male market something that's growing?
Yeah, I think people are just more comfortable. You know, I really believe, not to toot my own horn, but that Extreme Makeover show, you know, was shown in 150 countries for 3 years, and it really raised the curtain away from the mystery of plastic surgery, and everybody's plastic surgery IQ went up, and I think their demands for more natural results went up, and you know, it increased the number of plastic surgery patients in the United States 30% the next year for every plastic surgeon.
Oh my gosh.
65% the next year.
Whoa.
And it was a ripple effect through every beauty industry, Sephora, everybody just went up because of this show. And so I think that was the beginning and the launch of like the age of people feeling comfortable with it. And it was out of the shadows. And I think people were okay. You know, I look better. You know?
What about international plastic surgery? I mean, I've seen, you know, we see all the joke videos on Instagram of the plane loads of men going to Turkey for hair. But I also know there's a lot of people just going into Mexico or to other countries for, you know, surgical procedures. I mean, again, I think it's just you have to really know what you're doing.
You have to be careful.
What are
I'd
your
love to use your
thoughts?
podcast for an important information about that. I had a patient that had a facelift on last year, had 3 friends in their 40s, early 40s, a little bit overweight. They wanted to get gastric stapling. Yeah. They went to Turkey for gastric stapling, left on the same day, came back the same day, didn't tell anybody, these 3 girls. They came back the same day. About a month later, one of the girls went to Turkey. You know, one of them says, I have stomach ache, went to see her doctor. The doctor said, something's up with your stomach where they did the stapling. You need to go to an MRI. She went to get an MRI. Radiologist comes out, says, how long have you had one kidney? She says, I have 2 kidneys. She said, you have 1 kidney. Told the story, brought her other friends in there.
No.
The other friends came in. All 3 of them had their kidneys, 1 kidney removed, going to Turkey, and the gastric stapling. And I actually got an attorney. I called Robert Shapiro. He won't mind me saying this. I said, you need to help these girls. They lost their kidney in Turkey, all 3 of them. And the girls go, oh, I don't want anybody to know I had gastric stapling. They didn't want to even go further with this. But it's it is.
And the kidneys for what, being sold?
Oh yeah, those are valuable.
Yeah.
Those are valuable. Yeah. I'll give the surgery for free if I can get your kidney.
Yeah.
So be careful going out of the country because you don't know really what's going to happen. And you know, there's great doctors here. Don't go looking for a price break. I mean, this is your face, this is your kidney, this is your whatever, and
it's not worth it.
You know, maybe wait. But it was a dangerous situation.
Yeah.
That is mind-blowing
Horrific
and terrifying.
Horrific.
Wow. Well, I know you are so busy, and so we so appreciate you taking it, especially on your day off on Friday.
Thank you.
Thank you so much for coming in. Now, we do have one question because our patients, our listeners are going to want to try and find you. One, where can they find you? And two, are you taking new patients? Because they're going to want to know that too.
There's a wait list, I'm here. I'm in Beverly Hills. You can look up Garth Fisher, MD, and
What about Instagram? You have an Instagram?
I'm not an Instagram doctor. My wife does a good job. Just it's alive. But I'm getting a new website finally after 13 years. But I just don't do any social media, no advertising. I don't do that.
I mean, you don't need it, do you?
We're good.
Word of mouth is good for you. Well, thank you so much.
Thank
seriously,
you guys so
for
much.
coming.
Thank you. We appreciate it.
Rate 5 stars, like, subscribe to our YouTube, maybe drop a comment. I'm curious if this has made or broken someone's vision of for their own procedures. Dr. Fisher, normally we end this with have a splash, make a splash. Is that okay? We'll say have a splash. You say make a splash.
Make a splash.
All right,
Make a
ready?
splash.
Have a
Absolutely.
splash.
Have a splash.
Make a splash.
Absolutely.
Yeah,
Thank
thank you
you.
so much.